So I met Sarah when I went to Portland. I'd seen her on a video on a webinar, and that's what really got me interested in what they were doing. And we have a shared common interest. So this is her story. So just pause it and just read it. And my story is not dissimilar. And then move on to this. And this is basically Sarah sent me a series of videos showing how she looks after people in the care home environment. And so this is her treating Annie. And as it says there, just listen and repeat it, because the things that she describes as she's doing the treatment or the care, as you would describe it. And also, my own view was how dry Annie's mouth was. And that's what happens with the age. We need to keep their mouths moist. On the other hand, it was a lot easier to treating a child. So anyway, this is the series of videos coming up. So again, just pause them as you go along. But basically, it's about 4.5 minutes of Sarah looking after Annie.
So we can see Annie has some plaque along her gum line, interproximal, class 5, and food debris there in the buccal corridor of that vestibule. So we're just going to kind of remove everything so we have good access to apply the silver treatment. It's the soft debris we really want to get off there for her. And once again, you can see her gums bleed a little bit, but with all of this plaque, one would expect to see a lot more inflammation of the tissues. And because she is treated every 3 months with cleanings and silver diamine, there is actually a great reduction in the tissue inflammation, which is amazing to see from what it was when we first saw Annie. So now we're brushing the upper teeth here, just getting that cervical and interproximal plaque and food debris off so we have a clean surface to do the silver treatment. And you can see all the areas where that food debris was sitting are areas that previously have been treated with silver diamine. And once again, little bleeding, not too bad. So here on the lower left, we can see how dark these teeth are back here. This area just really traps food. And it just kind of sits in her teeth unless a staff member can help her brush and get that food debris out every day. So it has been very beneficial, but you can see how the tooth had a lot of incipient and demin, that it's protected it from making a cavitated lesion over time, as well as the gum health. So you can see here on the top, it's mostly this parotid gland I don't want the saliva to get to. So I'm just kind of going to isolate with gauze up there. And then I am drying. I dried all those teeth on the cervicals. One thing I want to mention is we do have informed consent from the POA guardian to apply silver diamine, and the patient has also consented to it. We always get that consent because of the concern of the discoloration. We also always tell patients and families that a tooth-colored filling can be placed on top, a GIC for example, if the area is large enough that it's trapping food, or if the patient is concerned about aesthetics. You can see the gum tissue will turn a little bit white. It can blanch it. It will go away within a few days. The teeth stay dark where there is an active lesion or incipient lesion. A healthy tooth surface does not change colors. Once again, isolating the parotid gland, keeping that saliva out. Just coming here and getting as many buccal lingual tooth surface areas. I'm not concerned about it turning areas dark where there's no lesion. I'm more concerned about the health of the tissues in those areas, and that is why I'm doing it on areas that have lesions as well as inflammation and no lesion. You can see how fast this is to do a silver treatment though. This patient's whole mouth has been treated within a couple minutes.
Okay, Miss Annie, we are all done with our treatment of silverdiamine fluoride and fluoride varnish. Can you tell us how that was?
Fine.
Was it easy? Was it difficult for you?
No.
It was easy?
Yes.
Okay. And any bad taste, or did we mask it with the fluoride? I think we used caramel. Could you taste the bitter silver?
No.
Okay, so using the gauze and everything isolated it, you didn't taste too much. Okay. And you know nothing to eat or drink for a little while here, about an hour to 2 hours.
Yeah, that's good because I won't eat till noon.
You won't eat till noon.
Yeah.
Okay, Annie. Well, we will see you again in 3 months. Thank you so much.
All right.
And this isn't new. I thought about this a while ago, is that the other things I'm interested in is the 3D printing. And this, I think I made this about 4 years ago, where I thought we could use bleaching trays, where if someone has a lesion, then you could apply the silver diamine fluoride in a reservoir, and you just have to mark it on the night guard, where on the bleaching tray, and that's how we could do these kind of things. And also now you think, well, actually it could work really well for periodontitis and for implants. There's no research been done on it. The first bit of research was in 2001 for silver nitrate, I think. Very little since then. There was an article that's just come out, if you go into Cochrane 2024, saying it's got positive outcomes. It needs more research, which it always is with Cochrane. But why hasn't it been done? My own view is it's too cheap. So I hope you found this reasonably useful and thought-provoking, because this is what I'm trying to do. And yeah, if you're I hope you're interested, but register on the site and you'll be able to promote these services. So if you learn the 3D printing, teledentistry, you do this, then you'll be able to promote your services online for the public, and ideally not just a website, but on a dental app. So there's a blog page there. If you go into the blog page and look up, I think I put it on there, the advantages of an app over a website. I will do that. And hopefully over the next few months and years we can develop a dental health service that helps us provide therapy for everybody one way or another, because we can't just keep training more dentists, because the current business that we have at the moment is just basically treating what people want, which is high-end dentistry. But yeah, if you look on Dental Portal, you'll get all my views there on the GDC and how we need to change things. Anyway, that's more than 20 minutes, so I'll put something in the text saying split it into 3 or something like that. Right, bye.